Well, welcome into Health Talk Mississippi, a brand new podcast brought to you by the Mississippi State Department of Health. I am your humble host, Greg Flynn. Our episodes are meant to educate, inform, and entertain you a little bit about the services provided by the Mississippi State Department of Health and other organizations to empower you and keep you healthy. Today, we're going to talk about what is public health and really what it means to you. And we are honored to have in this inaugural launch of our podcast, our state health officer and our executive director of the MSDH. It is Dr. Dan Edney. Welcome.
Thank you, Greg. Glad to be here.
But, you know, a lot of people don't know exactly what public health is. You know, when people, the general public think about it, well, I'll just go down to my county health department and they offer shots and they offer tests and things like that. But man, it is so much more than that, isn't it?
It is. We have one of the largest jurisdictions within state government in terms of working with the public. And really, it's probably easier to say what is not public health, because so many things that are done and not done really impact the health of the population. But, you know, at the Mississippi State Department of Health, you know, we touch every life every day. Every Mississippian is touched by our work in one way or another. When you look at the jurisdiction and responsibilities that we have to keep the water supply safe and clean, to keep food safe and clean, to keep the hospitals well-regulated and appropriate, to keep nursing homes, child care, ambulatory surgery centers. I mean, you name it, on and on and on. You know, we have broad responsibility and authority to license and regulate and then work to specifically protect the health, safety, and well-being of everyone in Mississippi. And you know I like to add on without any exceptions.
Absolutely. As you like to say, public health is public wealth.
It is.
And what do you mean by that?
Well, when you look at the three leading causes of death in Mississippi, that's number one, heart disease, number two, malignancies, cancers of all type, number three, accidents, which really kill a lot of our young people. And then you also add on maternal infant death, which is just a real problem that we struggle with in Mississippi. Just calculating the negative economic impact for those four causes of death, nothing else, just those four. That's $25 billion with a B, billion dollars per year negative impact to an economy whose gross domestic product is about 122, 123 billion. So a substantial negative impact. So as we improve the health of the population of Mississippi, we improve the economy of Mississippi. Some of the best economic development we could possibly do is to invest in the health of our population exactly as we have the education of our children. And we have seen what happens when you make the right investments with the right policies in place, as we've done with education. We've moved from 50th to 16th in the most recent Kids Count report. What if we did that in health?
Unbelievable.
That's the way to attack poverty in this state, Greg. And this is the very, very real negative impact that you and I and everybody listening lives in every day. We've never noticed it because it's baked in and has always been there. But I will tell you, it's less than it was 3 years ago because we're making strides in public health. The needle is moving in the health of the population. And that's what public health is, you know, when I was in private practice for 32 years, I had about 4,000 patients over in the western part of Mississippi. Well, now I've got 2.9 million. And it's made up of all these diverse populations that are very unique and have their own unique challenges. And then, you know, different communities within the state, different regions within the state all have their own challenges, resource needs, and they also need their own strategies to improve their health. So a one-size-fits-all approach does not work and will not work. But as we really pay attention to the population needs of our state in terms of health and safety, we will see us move from the bottom. I'm convinced.
Well, and when you look at, people understand that this state is not a one size fits all. I mean, just driving around it, you can tell that you go to North Mississippi, it's not like the coast. You come to the Metro Jackson area, it is not like the Delta, but they all have one thing in common. that these diseases you talk about, the killers, are all preventable.
Yes. And we in Mississippi understand that. I grew up in the Delta. I have lived in the South Delta professionally and continue to live there now. I have raised my family there. Jackson's a different world from where I grew up and where I go home to every day. And the Mississippi Gulf Coast is a different world, and Northeast Mississippi is a different world, and East Mississippi is a different world, all from each other. We understand that. Folks in Washington don't understand that. Folks in Atlanta at the CDC don't understand that. And so part of my job is trying to help people in Atlanta and Washington understand what the public health needs are for Mississippi and how the approaches in Mississippi need to look for them to work and be successful.
Well, and certainly we know that the Delta has the biggest challenges, and I really want to get into that in a little bit here. But, when we talk about across the state, it's not just the Delta that has more challenges. But again, our job has been to educate people because it's all personal responsibility, right? When it ultimately comes down to it, people have to seek care. They have to know they want to have to get better. But it's what you've really been spreading throughout the state is knowledge is power, and knowing your numbers and getting your proper screenings. That's good for everybody.
It is. One of the most difficult statistics that I deal with is the fact that we lead the nation in preventable deaths. That means more Mississippians die every year unnecessarily than anywhere else in the country. And for me, as a physician, as a father, as a grandfather, that is just really hard to process and deal with. We're a population of 2.9 million or so. If we were able to bring our health outcomes to average, not above average, just average, then our mortality rate would drop to a point that we would really be a population of about 3.3 million. That's another congressional district. But we have lost a congressional district, not just to brain drain people moving away, but to brain drain of people moving into the ground too soon. And as we get healthier, our population will grow and our economy will grow. And people in Mississippi will have a life expectancy that will grow as other states that I'm jealous of. And our people will be healthier and happier and more prosperous.
One of the things that is fascinating to me is, in your world as a physician, where you treated people every day, to now your role is running the State Department of Health. How do you, and I don't know if you figured it out yet, how do you light that fire under people that it's like, yeah, I know I'm not supposed to eat fried food. Yeah, I know this. And it's just, you can't get them to understand that.
Yeah, I think people understand it better now than they ever have. The problem is, how do you overcome the excess burden of heart disease, including stroke, heart attacks, the impact of diabetes, hypertension on a population that doesn't have insurance and doesn't have the ability to go to the doctor the same way you and I do. If you and I don't take advantage of wellness checks, that's our fault.
Mm-hmm. It is.
But the majority of folks in Mississippi that don't have insurance don't know what a wellness check is. And if they did, how are they going to access it? Because they're not just giving those away for free. It's the whole concept of health literacy, health education is really important. And when we talk about heart disease, diabetes, obesity, we're really talking about generational issues but I'm a firm believer we got to start somewhere, and we have started, and we're starting to see the needle move a little bit. But, if the only food that you have access to is the fried chicken down, at the convenience store for a quick lunch, that's what you're going to eat. Mm. If you have SNAP benefits and you can get more food to feed your family by getting less expensive food that has much lower nutritional value, that's what you're going to get to take care of your family. So some of this is policy decisions at the state and federal level. And then some of it is individual, has to do with individual decisions. As I'm challenged with people saying, well, this is all personal responsibility, Dr. Edney. So that's a big part of it. And I fought personal responsibility for a long time in private practice. But, my good friends in Alabama are no more responsible as individuals than we are, but their outcomes are better. People in Louisiana don't have better personal responsibility.
That's for sure, yeah.
Arkansas sure doesn't. And yet all three of those states have substantially better health outcomes than Mississippi. Greg, what drives the bus in our state is poverty. Poverty in a way that other states just don't understand. And Mississippians don't understand the poverty of the Mississippi Delta unless you go. And the majority of folks that live outside the Delta they may have driven through the Delta, or they may have gone to an event in the Delta and turned around and left, but very few have really seen, the impact of poverty in the Mississippi Delta and what that does to the population of the Delta, white and black.
Well, it's one of those things, as you said, people may drive through the Delta, and we can't really relate to that. Yes, Mississippi is very rural, but when you're living in the metro area a lot, when you're living on the coast a lot, where you take for granted that, okay, I'm going to get in the car and I'm going to drive down the street and there's my Kroger, my Walmart, whatever there is, to be able to go and get some fresh produce and to be able to go get the more nutritional type things that you're talking about. You don't find that in the Mississippi Delta.
Yeah, that's actually why I'm real proud to see the DG Market stores opening up, because those are little grocery stores that are popping up with the Dollar General model. That is, but when you look at the old, long-standing, true grocery stores, they're evaporating in the Delta. We have people that literally the closest real grocery access may be 45 miles away, and if you don't have a car, that's tough. So there are some innovative approaches to get healthier food closer to rural populations. We're not there yet. But when we talk about these generational approaches, we have to get so far upstream from where we are today. Right now, you and I are just paddling that canoe as hard as we can not to go over the waterfall when we need to be way upstream. And the way we get upstream is by educating our children. And so working with the Department of Education to help improve health education, health promotion for K through 12. We're already in Head Start, but then to have K through 12 have health promotion, not another health class. I don't want the kids hating me because they haven't taken another health class. Don't even test them on it. Just teach them. That's how we got seatbelts in place. Lord, I never wore a seatbelt when I was growing up. Did you? You're as old as I am.
No, I have not. And then we used to ride in the back of the truck, and it was all safe and everything, right?
Yeah. And today, none of us would think about getting in the car without putting our seatbelt on. That came about by teaching our children in school, who came home and said, "Daddy, put your seatbelt on."
But you do have that challenge. So again, if you're in a very rural area and we teach them, you put signs up in the school all the time, posters about eating healthy, and they go home, and then still, if you're in that food desert, for lack of a better term, it's hard on those parents to even be able to do that.
And they live in a food desert, and they live in an obstetrical desert, if they're pregnant, and they live just in a basic healthcare desert in a lot of places. I tell folks, look, access to care, which drives a lot of our poor outcomes, just having Mississippians having difficulty accessing just basic health care outside of an emergency room. There's some areas of the state, it doesn't matter what your insurance is. If you live in Issaquah County, Mississippi, there is no health care outside of a dialysis unit. So you've got to hike to get to health care. I don't care if you have the best Blue Cross in the world. If there's nothing there, there's nothing there. And living in Vicksburg, we don't have the robust subspecialty support in Vicksburg that those in Jackson do. We have a strong medical community, but there are certain things you have to get to Jackson from Vicksburg. And there are a lot of communities like Vicksburg all over the state, that there's just not, full, robust, full subspecialty support. So you have to drive to get to it. And when you're looking at distance from healthcare, that impedes access, and it negatively impacts our outcomes. If you have a 2-hour drive to go for a regular checkup, how likely and you're working full time, how likely are you to go?
The very little chance.
That checkup.
Yeah, very little chance.
Yeah.
I feel fine. Why do I need to go for my checkup?
And so what if you're working shift work and you're working, 12-hour days, and then when you're not working, you're trying to, enjoy your family the best you can. There's so many things. Folks that have insurance have trouble accessing health care. How much harder do you think it is for our folks who don't have insurance to access it? And if you don't access health care, you're just not going to be as healthy.
So I know that I don't know, it's not a quick fix, but how do we start to move that needle to get these facilities where the people are and make them closer to people without, even whether not even just talking about the Delta, whether you live in, rural Smith County or Simpson County or anywhere up in North Mississippi. I mean, it's you've got to be able to get that closer to them, right?
Yes. And, remember, over half the state lives in rural communities.
Mm-hmm.
That's half the population is in this situation. So we already have started, and we're already seeing results. Our state elected officials enacted, several years ago, the Rural Physician Scholarship Program that pays for medical education for those who are willing to go do primary care in truly rural areas. That's paying dividends. Now we're investing in rural residency programs because the data is very clear that where young doctors train tends to be where they live and work. And so having them trained in rural communities has been really impactful. We have a family medicine program in Greenville, Mississippi, my hometown, in the Mississippi Delta. And about half of those young doctors stay in the Delta. Those are doctors who never would thought about going to the Delta. And that's wonderful, and we have family medicine programs around the state, internal medicine programs around the state, ER programs in rural communities because we need rural ER doctors. We don't need all of them working in the big hospitals in Jackson and Tupelo and on the coast. We need them in medium-sized hospitals and smaller hospitals. Training family medicine family medicine doctors with an extra year fellowship in OB so that now they're high-quality labor and delivery experts to help our obstetricians. That training happens in rural communities. We're doing the same thing with dentists, doing the same thing with nurses, and that is paying dividends, as we speak. We have moved, and the more workforce we have, the more likely folks will be to live and work in Vicksburg or, and Port Gibson, Mississippi, or Rolling Fork, Mississippi, and so there are thoughtful strategies, for that to happen.
Because it's almost like you can't have one without the other. So you need somebody to take the chance with building industry, giving somewhere people to go work and to be able to afford healthcare. And then on the flip side, you have to have people willing to invest in those healthcare facilities that are there and to keep population without having everybody gravitating towards a metro area.
Do you think a major manufacturer is going to build a manufacturing plant in a community that doesn't have an emergency room?
Yeah, no.
And all you have to do is look at the investment in the western half of the state versus the eastern half of the state. The western half, you follow those river counties, like Warren County where I live, right on the river, lower income, lower investment, a lot of agriculture. Mm-hmm. So that drives it too because land is very expensive. But, major manufacturers don't want to invest in communities that aren't healthy because health insurance costs go up.
Same thing with education, and that goes right along to it. They want an educated and a healthy workforce before they'll come and set up shop.
And, everybody wants to live in a community with good schools, good hospital, good medical community. That's just kind of like the basics. And we have a lot of communities in Mississippi that just don't check all those boxes, but we're working to check those boxes better.
Well, I know one of the hot button issues is, first of all, getting people healthcare coverage, right? And there's nobody's been able to come up with a good way to make sure that we can get people covered, whether it's Medicaid expansion, as they like to call it, or unfortunately right now, that's like the best option that we have that would be out there, right?
Yeah, so what we're doing at the health department is leveraging technology to screen the folks that we serve. In our county health department, it's 40% of whom don't have insurance. And a lot of times that's why they come to us. But a lot of what we've realized is a lot of the folks that come to us qualify. They just don't know. Or they know they qualify, but they don't know how, to sign up for marketplace insurance plans that may have a very, very low premium, if any premium, and very low deductibles and copays, how to sign up for Medicaid. And so we're working the county health departments with specific software that screens our folks better and then allows us to help them navigate through that process, which is not easy. Navigating healthcare is not easy. And especially you live in a rural county and you've got to go to a population center for your health care, man, that's a different world. So all these things are real challenges for our folks, and yet these are challenges that don't fix themselves, and that all of these challenges have solutions. And so it's above my pay grade to determine what elected officials are going to do with health policy, but it's well within my pay grade and within my statutory responsibility in state law to promote good policy, to raise the awareness of where we are with population health, to educate our elected officials about where we are, to be educated ourselves at the Department of Health of what solutions are on the table and what that means, and to be a trusted, responsible partner to get the information, the data that they need as they decide, and then also to advocate for what we think are evidence-based policies that improve population health.
We all know it. I'm now 31 years now here in Mississippi. Never thought I'd be here this long, but it just has that gravitational pull to it. And, everybody says, oh, Mississippi's great. Those that from outside of here don't realize how good we are. And it's such an easygoing, slow-paced form of life. And yes, while it is that good, then we all know, you have pointed out many times that we have the lowest life expectancy in the nation. And that is scary.
Yeah. The life expectancy of an African-American male in the Mississippi Delta right now is 65.
Unbelievable.
And I'm 63.
Unbelievable.
That's ridiculous. And it's not because 65-year-old black men in the Delta want to die. It's all the things working against them, having healthy lives, many of which are personal decisions, but also personal decisions that have not been accompanied by proper health promotion earlier in their life, so that they truly understand the impact of smoking, of high fried food content in your diet, being overweight, being sedentary. These are things that a lot of people would say, well, everybody knows that. But no, they don't.
No,
they really don't. We have to help them understand that in a non-judgmental fashion. Preaching does very, very little good in public health, I've come to find. But educating folks with, using health literacy techniques so that you're communicating at the right level in a way that they can understand, and in a way that they can take that information and apply it to their lives to the best of their ability. But then recognizing the dangers of social determinants of health that poverty drives, lack of transportation, lack of access to healthy food, lack of access to ready emergency care, to lack of access to fairly quick, easy to access primary care medical homes. I really think one of the things killing more Mississippians prematurely is the fact we have a large segment of our population who just don't have access to primary care medical homes. And I was a primary care internist, for 32 years in Vicksburg. I know the power of a medical home. I know how important they are. I also know how hard it was for many people in the area of the state in which I lived and worked and loved would have the trouble they would have accessing it. And then, we have another segment of the population who does have ready access, who just choose not to.
Well, and that's
to access it.
And that's the big question you have. It's a happy medium of educating and proving to people that preventive healthcare, is what you need to do. Mm-hmm. And then there's also the fear factor. You don't want to do it out of scaring people, but no, the bottom line is if you don't go get checked, we're just coming off of Men's Health Month.
Right.
And it's just like, okay, if you don't get your colonoscopy, if you don't get your prostate screening, there's a good chance you'll die.
So fear really gets in the way with men's health in a very powerful way. And one thing we're needing to educate is the need to no longer fear this, but the fear of the finger with men is a very real thing. But now, the evidence is very clear that the majority of men who are asymptomatic and not at high risk, the finger doesn't do a whole lot of good.
Right.
And everybody knows what I mean. But that keeps more men from going to the doctor than you can imagine. And so, getting the word out that, you can be screened for prostate cancer without having to go through a rectal exam. You can be screened, for colon cancer without having to go through a rectal exam. Getting the word out that every person listening today who's 45 or older needs a colonoscopy, period. I don't care what your risk is. The evidence is very, very clear.
Yeah, because just because you feel fine on the outside, you don't know what's going on the inside, right. And that's half the battle.
Yeah, colon cancer is a preventable illness. If you submit to your screenings and stay on schedule, you won't die of colon cancer. So these are all things that we have to keep working on. I say, my generation, too late for us. We've baked in our health problems. But by this point, I'm 63. For those who don't know, but for my grandbabies, it's not too late for them. Our children, our young people, it's not too late for them. Young adults, it's not too late. And then the causes of accidental deaths that kill our babies, just comes through the need for education, making sure infants are in car seats, making sure that you're not co-sleeping, with your little ones, because we lose children and infants to strangulation and suffocation by co-sleeping with mom and dad, in the bed. We lead the nation in firearm deaths that relate a lot to gun safety. It has nothing to do with gun control, but has a lot to do with gun safety and storage. Mental health challenges with young people. Our suicide rate in adolescence is going up. Those are all preventable deaths. We are making big time headway with overdose deaths, which are almost all young people at this stage of the game with fentanyl. So, we still have lots of opportunity, but we've had lots of success as well, Greg. So, and this is all public health. Everything we have talked about, we've been all over the place, brother. Everything we have talked about, public health, is it not?
It is, absolutely.
And if you don't believe me, pull state law that looks at the state health officer and the Mississippi State Department of Health, and you will see state directives for us to be working on these things. People ask, why do you care so much about maternal infant death? I said, well, first of all, I'm a daddy and I'm a granddaddy, and I'm a Mississippi doctor who's tired of this, but out of my state obligations and state law, number one on the list is to mitigate maternal infant death. And I take that seriously. And that's why it's one of the top tier priorities of our agency. But all these things are public health. Everything that we've talked about is public health, and public health saves lives.
One final thing I wanted to touch on, because it's just very timely as kids are getting ready to go back to school. And, I know we have, state mandated vaccinations.
Yes.
What would you say to people that are on the fence now between what's, coming out of Washington, D.C. surrounding vaccines, and for a parent that's like, well, I don't know, do I try to get an exemption? I don't necessarily believe in the vaccines. What are you trying to tell those folks?
Well, The same thing that we've been telling them, realize and understand that immunizations and the science of immunizations have been one of the greatest breakthroughs in modern medicine that has saved way more lives than antibiotics. I find it interesting. People believe in antibiotics, and we're trying to get them not to take as many antibiotics, and they may not believe in immunizations, and immunizations are every bit as safer than antibiotics, and save a whole lot more lives around the world every year than antibiotics do. But the great public health victories that have saved millions upon millions of lives are immunizations, clean water, proper sewage, and safe food. All those together, they're powerful. Immunizations, clean water, proper sewage, food protection. Which one of those do we give up? I mean, for me, just as a doctor, that turning our backs on immunizations is like, okay, well, don't worry about the water. Don't worry about washing your hands after you go to the bathroom.
Mm-hmm.
The sewage isn't as big. We can go back to dumping sewage out the window again. These are huge breakthroughs. The reason we have our current state law was enacted that where the exemptions that were in the original law were taken away, occurred in 1979 after large measles outbreaks. Guess who drove that bus? Mamas. Because they had had enough, and they demanded that the legislature take the exemptions out, except for medical, which I fully support medical exemptions. And, and it was made clear in state courts, including the state Supreme Court, that the state does have an overriding interest to protect the public. And for us, our vaccine law has protected those little ones who needed medical exemptions, but they were still safe because our population was safe. It's why we've not had an endemic case of measles since 1992. We had one case in 2002 that was an unvaccinated traveler, but didn't spread to anybody. That's powerful. You go back to look at historically the number of babies who died every year from measles. And then you see in the late 60s, those deaths just evaporate. They just go away. So we've not had a case since 1992, but we've not had a death since the 1960s, early 70s.
And I love the point that you brought up, too, that there's a lot of doctors out there right now that unless they read it in the textbook, they've never seen it. And there's a possibility that they'll be seeing it in the near future.
No, we're having to educate because we know where this bus is going, and we see what happened in Texas and what's happening in New Mexico and Oklahoma. So we are spending time educating physicians on how to recognize measles for when it does raise its head again. We're dealing with pertussis or whooping cough, which is really scary in infants. We're having a resurgence of that. My mother, shared with me the grief of losing her youngest brother, to diphtheria as an infant. Totally vaccine preventable now. So the message is that the best defense you have from your little ones not dying or becoming seriously ill and having serious complications from these childhood illnesses is through vaccination. It is our best defense. Any drug can cause anything to anybody. Tylenol causes problems. Aspirin causes problems. Most of the over-the-counter drugs out there cause a lot of problems, and yet we understand that. And but vaccines are studied more intensely than anything else, in the pharmacopoeia of medicine today, because it is looking at preventable illnesses. We don't want polio back. I'm old enough. I had mumps when I was 12. Mumps made a lot of little boys sterile back in my day. We don't see mumps anymore. We don't see chickenpox anymore. So guess what? My children and grandchildren will never have shingles because they won't have chickenpox because they're vaccinated. And Lord, we sure don't want tetanus.
No,
tetanus is a horror story. So diphtheria is a horror story. These are things that my parents' generation remembered very well because it was killing many of their age group. My age group remembers a lot of things with measles, mumps. Polio had been calmed down by the time I was 10 or 11, but these things will come back. They're still out there. We haven't eradicated them. We came really close with polio worldwide. Rotary Club International's done a great job working to help eradicate polio worldwide. We're not there yet, and we don't want it to fight its way back. Measles will jump on us right away, as we've seen it in Texas and New Mexico. And I never want to see another child in Mississippi die of measles ever again. We haven't since the late 60s, and there's no reason for it when we have the science of immunizations that are so effective in protecting our children. And those, immunizations for flu and pneumonia will save our older folks too, from dying of flu and pneumonia every year unnecessarily. So every fall, get your flu shot. And if you've not, if you're in your 60s and you've not had your pneumonia shot, go get it.
Well, that's the point of our podcast, is to hopefully not only educate people from an objective point of view that you bring, but also to help them make the most informed decisions. And we appreciate you giving your support to this podcast. And I think it's going to be hopefully enlightening to a lot of people as we move forward.
Thank you, Greg. So glad to be here. We'll always be happy to join you, and just really appreciate everybody listening, supporting public health in Mississippi.
All right. That is Dr. Dan Edney. He is your state health officer and the executive director of the Mississippi State Department of Health. That's going to do it for us on this edition of Health Talk Mississippi. We will talk to you again soon. I'm Greg Flynn.